Doctors and other health workers sometimes can find it quite confusing, even quite threatening, if people bring along information that they haven't had access to, and that's been a long-running sort of issue around in society. To what extent one can have an openness sort of feeling between health staff and patients is sort of going to be an ongoing discussion. The curating of good sites is going to be a really important issue, I think, for user groups and the medical profession to help them with this dialogue in future. The user site in North America, in at least one of those conditions, was identified as particularly useful. It may be much larger and better funded because clearly it's a larger country, but I think people can learn from each other. There's a slight problem with charities in that, say, in epilepsy there's about 25 different charities and they're in competition with each other. And this may actually decrease collaboration both between them and their ability to talk to people abroad. So, one would like to see them sort of looking at what they're doing and maybe collaborating, because they could produce a lot more quality product if they were working together. The user groups and the others, they might even think about what synergy they have between them, bearing in mind that English language people are going to pick up information on different sides of the Atlantic in particular. Probably there needs to be even more links between user groups and the NHS. How to keep them independent so that they are advocates for things that are not provided is important, because if you fund them and make them entirely part of the NHS, then they'll stop using their sort of pushing power. So I think there's an inevitable conflict there that you have to acknowledge.